Hi. So today we are going to talk about how to do quarterlies for DD support coordination. Okay, so let's get started. I've got my trusty practice client, Tina Testing, up here. And I have already entered and selected DD support coordination as my cost center location. And I have my treatment plan down here, ID support coordination plan, and I'm gonna jump in and do my quarterly, right? Well, hold up, okay? Because first, I always recommend running a progress note report and reviewing the notes for that quarter that you're about to write that quarterly for. Okay, let me show you how to do that. So I'm going to go to Profile of Client. And there's Aaron, if you've met Aaron in the IT department, we use his picture for practice. There is a report button at the bottom of the Profile of Client screen. Okay. And the report is called Progress Notes, All Providers. If your progress note report list or whatever, your whole report list is not in alphabetical order, click on this heading that says report full name. It will alphabetize them for you. Okay. So what I like to do is click on this progress notes all providers and then click run report. Then it lets you select a date range. Okay, so I strongly recommend, like, let's say my client Tina's plan year started July 1 of 2021. Okay. And it ended 90 days after that, right? That's our first quarter. Quarters are 90-day periods of time throughout their plan year. Okay. So I'm going to say through the 1st of October. Okay. And a lot of people will use Siri or Google, like, what's 90 days from this date? You know, what's 180 days from this date? So, you know, when your second quarterly is, what that period of time is. So you put your dates in there, right? And then you scroll down and you click OK. I don't know if Tina has notes during this period. Yes, she does. Okay. So Tina's my practice client, so she doesn't have any real notes. But so what you can do is you can use these arrows to page over, okay? And obviously for a real client, these would be real progress notes. And so I strongly recommend running this progress note report so that you can see what happened during that 90-day period of time for her. Because no matter how often or how well we know our clients, how often we see them, sometimes lines between quarters can get a little blurry. And so you can't remember, like, if something happened at the end of the last quarter or the beginning of the current quarter, or, you know, stuff happens. And then especially as you have multiple clients and you're juggling caseloads and all this stuff, as long as your notes, have you been putting them into the system, you'll see your notes, you'll see nursing notes, doctor's notes. If any other CSV staff has also been working with your client, you'll be able to see what happened during that quarter. So then when you write your quarterly, you know that you are mirroring your quarterly review based off of what actually happened during the quarter and what's in the progress notes. And because what happens is, like, let's say we get audited and they're going to look at those quarterlies. I can't even stress how important quarterly reviews are, because if they are not in there, we have to pay back like all the money that Medicaid gave us for that 90-day period of time whenever quarterlies are missing. So missing quarterlies are a huge red flag. Another red flag on audits when they're reviewing quarterlies is if there is something really significant in the quarterly that is mentioned, but it is not in the progress notes, or vice versa. I write a progress note about something that happened during a face-to-face, or there was a crisis or whatever, and that quarterly review does not reflect that at all, because they should go together, right? So one of the reasons why I highly recommend using this progress note report to look at the services that and the notes that you put in, and even that other providers put in during that quarter, is you just make sure that you don't miss anything that might be significant for that person. So let me get off my soapbox about how much I encourage you to run this report. I'll hit the X. Really do encourage you to run that report though. So then I'm going to hit the save or cancel just to close this profile of client. Now, once I have looked at the progress notes for that quarter, I'm going to go down here to where it says ID support coordination plan. So if you have, or DD support coordination, if you have DD support coordination in this cost center location area, your plan should kind of pop up right there. And we are going to this green plus at the very bottom right-hand side. Okay. You'll see ID ISP reviews. Remember, Tina is a testing client, so all of her, she doesn't really get 90-day quarterly, so these dates aren't going to line up. But for a actual client, you should see kind of a pattern. About every 3 months, you're going to see the effective date of the quarterly, and you should see them. If you have a client who has been with us for a very long time, they might have a long history of quarterly reviews. If you click on this heading that says effective date, it will put the oldest to the newest, or the newest to oldest. It makes it a little bit easier to sort. You want to view one of the quarterlies that's already been completed, you just double click and hit open and you can view it. So I'm going to click on this green plus here. And in the form drop-down menu, there's one called ID ISP review. In our current version, so today is October 6th of 2021. Our current version is version 4.2, and I even have a little note on it as of right now that says use for quarterlies July 1 and after. Obviously, before the next July 1st or so, I'm going to have to kind of modify that name, but we have recently changed it, so I wanted to make it clear which one to use. So it's the version 4.2. You just want to make sure that you don't click on the ones that say NCSB, because mental health and substance use staff use those quarterlies for their clients. They have a different format, so it's not going to include all of the information that you need on yours unless you choose the one that says ID. I'm going to select open. And the treatment plan date, that is the date that we were talking about. So we're talking about my client was 7/1/2021 was the start of my new plan year. There's even a calendar here. I'm going to click the calendar so my dates will format correctly. Okay. The date of review is 10/6. Okay, so that is in my my window. Okay, so that I'm reviewing this 90-day period. We'll say from 7/1 to 10/1, but you can even say, you know, hey Siri, when is 90 days from 7/1/2021? Remember, or you can Google it, or, you know, just make sure that that you're reviewing the right time period. This is our first quarter, because again, it's 3 months after the start date of the plan. Okay. Your second quarter would be 180 days from the start date of your plan. So you'd be reviewing that like 91st day period of time through the, you know, up to 180 days, like that window. Okay. First quarter, second quarter, third quarter, and then the fourth. Okay. So obviously there's a year and it's split up into 90-day increments, and that's kind of how that falls. We don't typically use unplanned reviews for ID and DD support coordination. There are some staff across the CSB that may have a need to do unplanned reviews, but I've never seen y'all have to do it. Where it says general status of the individual, including health and safety, that kind of reflects the status of the individual on the progress notes. This is where you want to put any of those pertinent issues, particularly for health and safety, that happened during that period of time. You can also include significant events during this review period. Sometimes people think that you can only include negative significant events, but you can also include positive significant events, like if someone had a birthday party, or they saw a relative that they had not seen in a long time, or they learned a new skill and they were really excited about it, or got a gift that they really liked, or attending an outing that they were really pleased with. So you can also include positive significant events. Is the consumer satisfied with their services? If you select yes, nothing happens. If you select no, a box drops down. It says explain to include how staff will improve the consumer's satisfaction with services. We all know that we cannot please everybody. So sometimes they may not be satisfied with certain services that they're getting for maybe a very good reason. They may not also be totally satisfied with us. And some of that stuff is not in our control, and some of it is. So if you select no, be sure to elaborate, and that's what this drop-down menu is for. Okay. Are there any changes the consumer wants to make to their service? In this case, if you select yes, the box drops down. And if you select no, you don't have to elaborate. So it kind of makes sense. Are the current services and supports appropriate? Yes or no. And then you have this sort of static box that is there regardless of whether you select yes or no. Why or why not? Do they have any transition needs? Again, if yes, what do they need? If no, nothing additional pops up. Do you need to verify the license? Okay, so if they're receiving services from a licensed provider, there is a website you can look at to verify whether the license is active. It could be like conditional or provisional, or there are a couple of ways that places could lose their license or get it suspended or whatever. And they don't always tell us when that happens. So if you select yes, you can explain more here, okay? So that's if they are receiving additional services or certain services, and we're checking the license there. It's a good habit to be in, to not just kind of breeze through that, because we have had, our clients may need to go to enhanced case management depending on the licensing status of where they are. And that just makes sure that you've covered everything. Are there any modifications to the ISP? If no, so we haven't changed anything this quarter, we're just going to say no. If there are, we say yes, and it says describe modifications. So let's say if housing wasn't an issue when we had their annual meeting and developed their plan, but now it is, we may need to modify their ISP, and we would describe modifications there. Are there issues that the consumer has declined to address at this time? If no, then no. Okay, great. If yes, then it allows you to explain. So let me explain a little bit about how this can sometimes be used. When we get audited, we also, there's usually like a nurse that audits, as well as different providers as part of the auditing team. And we can not necessarily, well, not at all, force somebody to work on something that they don't want to work on. So for example, we've had an audit where the nurse was like, this client is smoking 2 packs a day, and how can we allow that at the CSB, because that's terrible for their health. It's not on their plan, as something that they're working on. And frankly, that, they didn't like that. But Maybe we talk about the dangers of smoking, that many cigarettes or in general with the person, but they are not ready to work on that and they refuse to work on it. Okay. This is exactly what this is for. So if there's something that we have addressed, but is not included in their ISP, you can say, you know, they're not willing to work on that issue at that time. And we have brought up that is a significant health risk for them. But right now they're not ready to address it. That would be something that we are not addressing, but for a good reason, the person doesn't want to. That just kind of covers as to why are we not addressing a particular issue in their plan. So progress towards outcomes, and this has a very good description, list all outcomes, indicating progress for each based on the written quarterly review of supports for each waiver service. So you should be getting a quarterly from each waiver provider to you, okay? That's why you have a window of time after that 90 days, because you want to get all the quarterlies that you possibly can from the waiver providers so that you can review them. So you're not only looking at the notes that we ran for our support coordination services, but if Hoop House sent you a quarterly and someone else sent you a quarterly, you can review them and address the progress there. Okay. I have seen it, and it is certainly an issue where sometimes we do not receive quarterlies from the particular waiver services. So you may receive one, but not another, or you may not receive any, and you need to get your quarterly done because you are bumping up against the due date. Okay. So if you don't receive a written quarterly from a provider, you can also indicate that there. It also says includes outcomes from your support coordination support plan. That includes things like linking, monitoring, advocating, coordinating, and assessing any of those things that you did during the quarter and their progress towards those as well. And then it indicates, please indicate if outcomes are to be continued, revised, or ended. So again, like if anything has changed or modified. So the descriptions on this quarterly review form are actually pretty in-depth, and we try to make it so that you get guidance kind of all the way down based off of what is written on the form. But if you have any questions about that, please reach out to your supervisor or to Holly Edwards and or, you know, the program manager. And they will be more than happy to help you. And if there's any issues in regards to how things work in Profiler, I can help you as well, especially if you have any trouble or problems with your quarterly reviews in Profiler. We won't know that there's a problem if you don't say anything. Okay. So your provider name will pull in. The date you completed it will also pull in. Okay. If you save this, so let's say I start working on this, but I'm waiting on one quarterly review from a waiver service. I can hit save. Reminds me to final save if I've completed it. Okay, so that's because save allows you to make changes. Whenever you click save and it closes, please, please, please always click the effective date right here. And you have to save this box. Okay, if you hit cancel on this box, your quarterly will go away. It will think you do not want to save it. I can't tell you how many times that I have seen someone do a quarterly and click the X here and it is gone. You have got to save this box for your quarterly to save in the list. Additionally, if there was anything like, I don't know, let's say if there was, and this quarterly doesn't have to be signed, so I can't think of what would be in this notes box as far as signatures or anything else, but this notes box is for like if a quarterly was scanned in or something for whatever reason, then that's what this notes box is for. But always, always, always click this save button right here. because that is the trigger for making it show up in this list. There's no minus button. Once it's in this list, there's no way to take it out. You would have to contact someone in IT if you happen to do like make a huge error on your quarterly. So as long as you save it, that quarterly is going to be in there. Now I am going to double click and open. Okay, so let's say my quarterly is here. Okay, and then because I have saved it, I can add additional information in here if I receive another quarterly review from a waiver provider. Once it's done though, so once I'm done with this quarterly, I don't want to see it again until next quarter when I do my next one. Okay, you want to click this final save. Final save will lock the quarterly, so no changes can be made after you hit final save. I can't change it, you can't change it, nobody can change it because you have signed and locked this thing. Okay, and you want to do that when you're done. Then we're going to hit save, and then I'll hit close. And that is your quarterly review. If you have any questions, feel free to ask your supervisors. Reach out to me for profiler stuff. That's what I'm here for. And thank you. I hope you have a really great day.